Let's switch gears now and talk about another presentation of respiratory disease that happens a little bit later in childhood. And let's focus now on alpha-1 antitrypsin deficiency. So in a normal person, we make neutrophil elastase. This is a substrate that is secreted by neutrophils to fight off infections. We protect our own bodies from these elastase with alpha-1 antitrypsin. In patients who are normal, they're making alpha-1 antitrypsin in the liver, as you can see here, and then this flows to the lungs and protects our lungs from what would be damage from this neutrophil elastase. So the alpha-1 antitrypsin is protecting our lungs against the neutrophil elastase, which we're using to fight off infections. In a patient with alpha-1 antitrypsin deficiency, the problem is they can't get the alpha-1 antitrypsin out of the liver. It's trapped in there, and that accrual is actually causing liver damage. Furthermore, because that can't get out of the liver, the lungs now lack the protection, and the neutrophil elastase is causing lung damage. This disease affects about 1 in 5,000 people. It's more common in Caucasians. And the liver disease often starts in childhood with prolonged jaundice and no clear cause. Lung disease typically starts in adolescence or young adulthood. If an adolescent is a smoker, they will dramatically worsen their lung outcomes. And the risk of hepatocellular cancer later in life is very real. So how do we manage these children? We worry about their lungs and their livers. We provide supportive care for their absorption of bile salts through liver dysfunction. They might have a problem, and we take care of that. In addition, we manage their lung disease accordingly. Intravenous alpha-1 antitrypsin is available, but studies haven't really gone forward yet in terms of how effective this is. So this is a developing area, and we may see future regimens involved in the future with intravenous alpha-1 antitrypsin, but that's a relatively new thing.